Good day everyone, we are Group 3 and for today we will be tackling about HIV and AIDS. So, we all know that HIV and AIDS is a life-threatening disease which everyone is scared to have simply because there is no medication found to cure the virus. So, our topic will cover about the disease itself, its symptoms, causes, mode of transmission, complications, and treatments. So, what is HIV? HIV is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. So, on the other hand, AIDS is the late stage of HIV that occurs when a body's immune system is badly damaged because of the virus.
And for the disease, the HIV positive individuals are far more likely to develop certain forms of cancer than HIV negative individuals of the same age. These cancers are collectively known as HIV associated cancers, of which three are referred to be AIDS defining cancers or AIDS defining malignancies. Kaposi sarcoma, aggressive B-cell, non-Hodgkin lymphoma, and cervical cancer. A diagnosis of AIDS is made when one of these malignancies is found in a person who is HIV positive. People with HIV are currently roughly 500 times more likely to receive a diagnosis of Kaposi sarcoma, 12 times more likely to receive a diagnosis of non-Hodgkin lymphoma, and among women, 3 times more likely to receive a diagnosis of cervical cancer than a general population. Additionally, those who have HIV are more likely to develop a number of other cancers, also known as non-AIDS defining tumors. These additional cancers include Hodgkin lymphoma as well as tumors of the anus, liver, oral cavity, pharynx, and lung. So the HIV positive individuals are 19 times more likely than the general population to develop anal cancer, 3 times more likely to develop liver cancer, and 2 times more likely to develop lung cancer, and about 2 times more likely to develop oral cavity, pharynx cancer, and about 8 times more likely to develop Hodgkin lymphoma.
Early HIV symptoms often appear within a few weeks to a month or two of infection and resemble a terrible case of flu. So early HIV signs and most common symptoms are raised temperature, sore throat, body rash, and other symptoms can include tiredness, joint pain, muscle pain, and swollen glands. On the other hand, HIV can lead to AIDS when untreated since AIDS is the most advanced stage of HIV. So the common symptoms of AIDS include recurring fever, chronic diarrhea, weakness, weight loss, persistent white spots or unusual lesions on your tongue or in your mouth. So other symptoms can also include swollen lymph glands, persistent unexplained fatigue, skin rashes or bumps.
HIV is caused by human immunodeficiency virus. AIDS developed from a breakdown of the immune system, a result of the fact that HIV infects and destroys a specialized group of white blood cells called T helper of T4 cells. And with the breakdown of the immune system, severe opportunistic infections develop. HIV is not passed on easily from one person to another. The virus does not spread through the air like cold and flu viruses. HIV lives in the blood and in some body fluids. To get HIV, one of these fluids from someone with HIV has to get into your blood. The body fluids that contain enough HIV to infect someone are semen, vaginal fluids, including menstrual blood, breast milk, blood, and lining inside the anus. Other fluids like saliva, sweat, or urine do not contain enough virus to infect another person.
Untreated HIV or AIDS can cause significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. HIV can cause neurological symptoms such as confusion, forgetfulness, depression, anxiety, and difficulty in walking. There are three stages of HIV infection: acute HIV infection, syndrome or AIDS. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. The HIV treatment, antiretroviral therapy or ART, involves taking medicine as prescribed by a healthcare provider. HIV treatment reduces the amount of HIV in body and helps you stay healthy. There is no cure for HIV, but you can control it with HIV treatment. Antiretroviral therapy cannot cure HIV, but HIV medicine help people with HIV